I'm joined today by Secretary of California Department of Veterans Affairs, Dr. Vito Imbasciani. Dr. Vito, thank you so much for joining us.
My pleasure, Nathan. Great to be here.
So you served as a doctor in the military. Give us a brief history of your military service.
Okay. It's wonderful. I come from a very military family. I was born at West Point. I worked there during summers in high school and college. I wound up being a resident in surgery and urology at Yale and training partly at the West Haven VA hospital. And I took a presidential commission as an intern in 1986 while I was at Yale. That meant the Army never paid for a single day of my education, and I promised to serve at least 7 years. Well, that promise grew into a 27-year commitment to the Army. 5 days after I finished my residency, it was early January 1991. We were technically at war, Operation Desert Storm. I was cherry-picked out of my reserve unit, and I was always in the reserves. I was never active duty except while deployed, and I was transferred to a wonderful hospital out of the state of Michigan National Guard, the 107th Field Hospital, and I was their urologist. And that was the first of 4 deployments, and I'll come back and tell you an incredible story about my deployment in Desert Storm and why I stuck out 27 years in the Army. I deployed again in 2004 to Iraq, to a very, very dangerous forward operating base 30 miles south of Baghdad. And then my third deployment was as a urologic surgeon. In Iraq, I was a battalion surgeon, which means you treat anybody that walks through the door. Any of our own American combat wounded, Allied soldiers, detainees, prisoners of war, local Bedouin farmers, and their wives and children with whatever ailments they had. My third deployment was to Landstuhl, Germany, where I took care of all the urologic surgical needs of anyone wounded in Iraq, Afghanistan, or any other point of deployment except Europe. So that would include Djibouti and other places that probably I shouldn't name. And my fourth deployment, to sort of round it all out, was to Camp Williams outside of Salt Lake City, where I commanded a unit that took care of wounded warriors coming back. We kept them in uniform on orders while they recovered until they had their orthopedic hardware or their stitches removed. We made sure that they had their follow-up with their doctors, because you know what happens when people come home from deployment. They want to take their uniform off and they don't connect to the VA for their benefits that they earned, and they can get into some medical problems because of that. But 27 years, multiple deployments on active duty, the rest of the time as a reservist, or since 9/11, 10 years as the state surgeon of the California Army National Guard, where I personally did every physical exam on any Californian soldier going off to war, and often when they came back also.
Well, what a remarkable career, and I can tell that you have been directly involved in saving lives, not only on the battlefield, but helping our service members transition home successfully and connecting with the VA. Now, you've shared a really remarkable story before that I've heard, but I'd like our audience to hear it. When you first served as a casualty evacuation surgeon in Desert Storm, and from what I understand, this is a good overview of how the situation for a doctor in the military can go from absolute calm to absolute chaos with just one helicopter landing. Can you share that story with our audience?
Yeah, absolutely. If you remember, I said I was a battalion surgeon in Iraq. Well, that was that's medicine out of a tent or out of the back end of a tracked vehicle. But when I was sent as a brand new surgeon, I was a captain, and I had not even been board certified yet, which meant I didn't have the ability legally to operate on my own. I had to have a sort of chaperone doctor ahead of me. I was sent to a wonderful hospital in Saudi Arabia, south of Kuwait by a few miles, so very close to the action. It was King Abdul Aziz Hospital, located on what we would call the Air Force Academy of the Saudi military. And because I was a young captain, and everyone else, all the other doctors and nurses were full bird colonels who had served in Vietnam, well, they took the day shift. And at night, at 7 o'clock, when the shift ended, they would take the 14-mile bus ride to Khobar Towers, which later became famous because of a terrible bombing incident by a suicide bomber. But I was the only doctor in this gigantic 400-bed hospital, along with 4 Army medics from the 7 p.m. to 7 a.m. shift. The hospital was deserted. All the pregnant women and children had been sent to hospitals in Egypt. We had a couple of POWs that were upstairs in the wards, securely handcuffed to their beds. And we were watching television when the alert came out at 9 o'clock on the night of February 26, 1991, that the Scud missiles had been launched from Kuwait and were coming right at our air base. So, of course, me and the 4 Army medics go downstairs, put our gas mask on. A few minutes later, we feel the ground shake. We didn't know whether it was the Patriot missiles or the Scud missiles, but after the all clear, we come up, and it turned out that two Scud missiles were shot out of the sky by our Patriot missiles, but one of them, unfortunately, fell out of the sky, came down, pierced the roof of a building that housed an entire unit of Pennsylvania reservists who had only arrived in theater that very day. A few minutes later, Saudi ambulances started arriving because that blast site was a mile away, and ambulance after ambulance started arriving, and the first to come into the emergency room were these soldiers completely covered in black dust and smoke. You've all seen those Keystone Cop movies or Three Stooges movies where the pie explodes in somebody's face and they get all black. I had to dust off the soot on the uniform, and I saw the subdued American flag, and I realized that these casualties, and they were definitely deceased, they were American soldiers. And I went, holy Moses. The first 2 of them were women, which leads me to some other reflections I might make later on. But the ambulances kept coming just with the dead soldiers. There were 5, 10, 15, 20, 25, 26, 27. We put them all in the mosque because it was a Saudi hospital, put a guard, and then we started treating the walking wounded. At that point, all the other doctors and nurses were out of bed in Khobar, and they had arrived, and we opened up the operating rooms. It's now 11 at night, and we kept operating through the night and for the rest of the week to take care of their needs. When I got home from Saudi Arabia and all the numbers were tallied up, we learned that 300 American soldiers thereabout died in that war. 150 from disease and accidents, suicide, asthma attacks, heart attacks. Other 150 were KIA. And of that number, I personally pronounced dead 1/5 of all the American casualties of an entire war in the space of 90 minutes on that February 26th night. Well, that cemented my relationship to what I do in the military. And, even though I served many years under Don't Ask, Don't Tell until that was repealed, I still was very dedicated. I figured if America was going to send its very best into harm's way, well, they deserved really good medical care. I don't want to flatter myself, but Yale made me a good surgeon and the Army made me a good war surgeon. So that's how I finished out my 27 years.
Well, what a remarkable experience. And I would imagine that must have been very difficult to be such a young doctor and handle such a incredibly traumatic event, trying to save as many lives as possible. I honor you for that service. In addition to the challenges you faced in combat, from what I understand, doctors face other unique challenges as well in their service in the military. Tell us a little bit about that.
Yeah, okay. Maybe I'll make it quick and just say there's 3 challenges. Desert Storm, doctors were mobilized in large numbers, larger than were needed, but they were put on orders for 365 days. And many of them, even though the war only lasted 5 months, many of them lost their practices. And when they all came back, many doctors from the medical corps resigned. So much so that the Pentagon went into a panic. And they came up with a wonderful program of 90 days boots on the ground. It happens to be 180 days for physician assistants, but for doctors, they can afford to go to war for 90 days, knowing that they'll be back on day 91. They can have other doctors cover for them and they don't lose their practice. So the number of people in the medical corps has gone up steadily. I hadn't even accepted my first job. Remember, they started me right after residency, so I was fine that way. The second is, personally, I was so close to so many exploding IEDs and mortars coming into this, either the green zone in Baghdad or my own forward operating base. I remember in the green zone, I was unloading some patients I was going to take to the Cash Hospital when 5 blocks away, a suicide bomber detonated himself. The shockwave, I was wearing IBA. I'm not a very large person, but the shockwave knocked me right on my butt. And so, I was exposed to a lot of these explosions around me that I wasn't prepared for. So for about 6 weeks, when I came back as a civilian, I had a startle reflex, which I think is a very minor form of PTSD, meaning my first day back in the hospital, I was in the cafeteria, somebody slammed a freezer door shut, made that low whoomp sound. And here I am in my dressed like this with a white lab coat on. I hit the floor. I actually hit the floor. It was a reflex reaction, but really more importantly, how does it affect me other ways? I had to be more than a doctor. I had to stop the bleeding and call in the helicopters. That was my job description. But for example, on my forward operating base, we had 200 Army MPs and 800 Marines that were probably between the ages of 18 and 22. And I had this one guy who went out for 5 days in a row in a tracked vehicle, it was destroyed by an IED each time, so 5 days in a row. And he came into sick bay, and he'd have that haunted look in his eye that we all know so well. And the question, you're like, hey, doc, why am I still alive? I mean, how many times do I have to, it's like Russian roulette, they feel. How many times do I have to do that before my luck runs out? And, I'm a surgeon. I fix things with a scalpel and stitches, but that guy got a hug, a long hug, and that's what he needed.
Right.
I had medics in my own unit who were starting to get really afraid to the point of physically being paralyzed almost, the kind of like, you almost want to slap them like, hey, come back to us, we're here.
Very much a psychologist and even a spiritual leader in a sense too. And your other comments also just made me think of who cares for the caretaker in this sense of being exposed to your own types of injuries from blasts and such. You're there to heal and help others without any time to actually address your own needs. And
no, it's true. And well, I got to tell you, the modern battlefield is lethal to the human brain. We're learning that more and more now. When I was training as a surgeon at Yale, my teachers would tell me the definition of a surgeon is when everybody around you is losing their mind, you're the one who doesn't. Mm. And so you take that message in. Mm-hmm. And you try to follow it. Can everybody follow it? No. Mm-hmm. I mean, there were times when I was maybe that close to panic too. Mm-hmm. In fact, one time the mortars were coming so close, my medics pulled me down onto the ground, 3 of them, and jumped on top of me. Mm. And I asked, what the hell are you doing? And they said, Doc, there are a lot of medics here. There are 20 of us, but there's only one of you. There's only one doc on this whole base. Mm. I got to tell you, I never felt more presidential in my whole life.
Mm-hmm. Absolutely.
But yeah, all of that. I think I'm lucky that I did not come back with more psychological baggage than I did. You know, as advice to people though, if anybody out there wants to be a 68 whiskey, an Army medic, a doctor considering, and male or female, doesn't matter. After those two fatalities that I pronounced, KIA and Desert Storm, I think every woman has every right to put on the uniform, pick up a weapon, and have a chance for recognition with valor that men do. But so I'm gonna quote two ancient Greeks. Plato said, "Only the dead have seen the end of war." So he's telling us we will always have conflict. But then there's a wonderful quote by Hippocrates. It's not in the oath, but a young man came up to Hippocrates, this is like 240 BC, and said, "I want to be a surgeon, and how do I do that? How do I learn?" And he said to the young man, if you want to be a surgeon, follow the army, meaning you will see everything.
Right.
And in fact, the Army has been the developer. Mass trousers that are used on every EMT ambulance in the country came out of Vietnam. These Israeli tourniquets that we now all use means nobody's going to die, even if they, as one young 21-year-old airman caught a mortar on my base and lost 2 arms and a leg and more. But he didn't die. He woke up 5 days later in Landstuhl because of these tourniquets. So you learn everything there is. American surgeons do not see blast injuries. We see penetrating knife and gun injuries in emergencies. You don't see blast injuries unless you go to war.
Right.
And you have an opportunity to take care of America's finest.
So doctors in the military, in a sense, are the cutting edge of advancements in medical technology and procedures.
Absolutely.
Yeah.
All of the development of all these powders that will stop bleeding. What are they called? Coagulation agents.
Right.
A lot of advances. In that critical hour now, with the advent of surgical teams that helicopter in to stabilize the patient right where he was wounded, or she, so that they can be safely transported to the in-theater hospital. And then when they're stabilized, then be transported 5-hour flight to Landstuhl, Germany. Yeah. And then when they're really stable, they can come back to Walter Reed or Brooke Army Hospital in Texas if they suffered burns, to learn for their rehabilitation, their final surgeries. And if it's prosthesis that they need, they train on that. That all happens CONUS.
Wow. My next question is, and this is maybe a little bit of a follow-up to this, in a sense that, how has your service as a doctor in the military shaped your life today?
Oh, that's a great question. In a sense, medicine is a retail business. You see one patient at a time. I'm a urologic surgeon. I take care of a lot of kidney stones, prostate cancer, things like that. But you see one patient at a time. But for some people, especially after experiences like Desert Storm, you have this almost compelling urge to want to apply your talents to treat larger populations. That's why I stuck it out with the reserves and became the state surgeon. Everything good that I've been able to accomplish in my life is due to the fact that the faculty at the medical school at the University of Vermont College of Medicine put the letters MD after my name, and my wartime experience becoming a veteran led me to my present job, where as Secretary of CalVet, I am responsible for advocating for and connecting 1.6 million California veterans to all of their benefits that they've deserved, whether that's housing, education, college fee, educating their children, getting a home loan, programs for incarcerated veterans, programs to build homes for homeless veterans, giving mortgages out to almost 500,000 veterans, and running the cemeteries, which is a sort of the final honor that we give veterans. And to do all of this by state law, I have to be a veteran to have this job, to sit in front of all these flags behind me. So the MD degree and my military service has opened up all of these doors of opportunity where I can serve, and I do so humbly. The most wonderful people in the state of California to me are the people that put on the uniform and served, many of whom left a lot behind on the battlefields they served on.
Well, Dr. Vito, thank you so much for your time today. I continue to be very inspired and honored to be in your presence and learn about your military service. And I thank you, sir, for your time as a doctor in the military and for the lives that you saved. So thank you.
Thank you, Nathan, and thanks for all you do for the veterans in your home county and for all the veterans in California. Thanks.
My honor. We'll be right back.
Bye-bye.